Hey guys, Kathleen here. Yep, still got my braces on, and I do have a broken wire, a broken bracket on back here, my very last molar, and then the wire is kind of flailing around a little bit, but it's been fine. I have to live with it for a few weeks since I'm not in pain, and I'll go to the orthodontist next week to have that fixed, and then probably take my arms off my Marpe. Not positive. We'll see. So the biggest thing is I did go to an oral surgeon last Friday, and some people have asked me, so you expanded the top. What about the bottom? Look at the bottom. I mean, it's still really far back, and it seems like it's even further back. So that was one of my questions to Dr. Evans at the beginning was, okay, we're going to expand the top. What are we doing about the bottom? And she mentioned a few things, and I just kind of put my trust in the process because I'd done quite a bit of research, but not sure about my particular case, what we were going to do. And I knew jaw surgery was always a possibility. So I did meet with the oral surgeon last week. That was that was Dr. Ed Zebovitz in Maryland. And what's interesting is my old orthodontist and my new orthodontist, who operate 2 hours away from each other, both recommended and referred me to the exact same oral surgeon without knowing it. And they only referred me to one oral surgeon. So that was a pretty big sign to me that I needed to go and do a consult with him and see what we were going to possibly do. So interestingly, I've got two things that need to be done. So really two different surgeries. The first one is not something that most people have to do. I have something called tori in the bottom of my mouth, bottom of my palate. I'll show you bony structures in the bottom of my palate. Those bony structures popping up there, those are going to be removed. So that's not going to be fun. Those are going to be scraped out. And it's about a 4 week recovery, maybe a little longer, because mine are pretty big. So I'm just, again, going to trust the process. But at the same time, it is doing that. He's going to be able to do that while my palate is still growing the bone. So it's still while the bone is getting hard and growing in, he's going to be able to do that surgery, and that's done in office. Interestingly, so but at the same time, he's going to do something called DICE, which is drug induced sleep endoscopy. So he's going to put while I'm drug induced sleep, he's going to put a scope up through my nose, down, and then check my airway while I'm sleeping. And as I'm breathing and seeing how it's collapsing, seeing what my tongue is doing, seeing why things are happening for me, as opposed to, when you have a sleep study, something's happening, your oxygen levels, you're not breathing a certain number of times an hour. For me, it's 20. But you can't see the mechanism. So he's going to actually go down and see what's happening, which I think is amazing. I think that's so helpful in determining what we should do. So then that can be done sometime in this spring. The following surgery, or this jaw surgery, would be late fall. He said this palate has to be like super strong. Everything has to be ready. No ifs, ands, or buts. We have to see how that goes and how long that takes. But depending on the scope, it will help give some information as to, do we think just a lower jaw surgery will be, adequate? Does he feel like he absolutely has to do a double jaw surgery? That kind of thing. So I am not looking forward to surgery. It's not something I've ever wanted, which I put it off for 10 years, even the discussion of it. I did talk to an oral surgeon almost 10 years ago, and yeah. So, but I'm at a point where I have to do this. So that's where I'm at. I will give you an update after I see Dr. Evans next week, the orthodontist, and then I have another virtual consult with the oral surgeon on February 5th. So maybe I'll just update you after both of those happen and just kind of show what I'm doing on my journey as I continue. Hope you're all doing well, and we'll talk soon.